things too that you want to do before this dips in water. Make sure you have everything ready to go, everything that you need. One thing I didn't tell you is a non-removable splint needs to have about 5 or 6 layers of padding. Okay? 5 or 6 layers of padding. A cast, 2 to 3 layers of padding. I dip this in water. Plaster, when I dip it in water, I wait for the little bubbles to run out. It's like little oxygen bubbles in there. Doesn't take very long. I pull it out, compress it down.
Never use hot water.
Yes, always room temperature water or cold water. I'll go down. I will come up in here and I will place my splint where it needs to be, making sure that my parameters are right on. And I don't like to do this. I would prefer that if you have excess, cut it. You will get messy.
I don't care. This is an old thing.
The reason why is this is your profession, people. You see how nice and smooth that looks? Now to preserve the ace wrap, and this is simply just to preserve that ace wrap. See how he's supinated too? Y'all put 1 layer of web roll on. Before I place my ace wrap on.
Is this the same as people at the car park?
I'm sorry?
They're the same as people at the car parks.
The car parks?
Yeah.
You lost me.
Ace parking.
Oh, yeah.
They're the same?
This is a funny guy. All right, here we go. Now, the trick comes in. This is why you have a job, people. I am going to hold his hand until this dries. How long do I have?
5 minutes.
Oh, we don't know if this is blue or green.
2 minutes.
2 to 4.
2 to 4.
2 to 4. Although I do, this is a little bit slower stuff for some reason, although I did order green. So, one thing I'm going to make sure, I have dorsiflexion, no radial or ulnar deviation, slight pronation, right? I give a 60s handshake. The reason why I give a 60s handshake is it really contours the splint in his palm. Make sense?
Mm-hmm.
And I get down on my knees in a chair, whatever it takes.
Ace wrap is nice. It's not all messed up, you guys. Don't come with a splint that's halfway rolled. If you need to use 2 ace wraps, then use 2 ace wraps. The only reason he popped that in there on the bottom right there is just to have in this
Just
class.
because I didn't have that, yeah.
Yeah, it's just
That
in
would
this
not
class.
look
It's
like
not
that
the way
in
it
real
looks
life.
in clinical. We'll have
Take pride in what you do. Really. You want it to look good. Clean your patient up, too. Before they come up to me, I do not want someone with plaster. I mean, they're going to have plaster on their clothes because you're not going to wash their clothes for them. But they'll have plaster up here, up on their fingers. See how there's plaster on his fingers and on his thumb? Before they come up, clean them up. Make it presentable. When I'm done with this splint and it's dry, I'm going to show you what I grade. Show you how I grade.
Wear a gown.
You can wear a gown if you like.
No, the patient wear a gown so they do get messy. Feel the gown not on their clothes.
Yeah, you can do that. I'll cover patients with sheets or towels, or sometimes not at all if I don't like them.
You generally don't get a patient too dirty.
Yeah, you're normally pretty.
You know what you're doing.
This is about as dirty as you get. What I'm doing here is making sure that I have no wrinkles. The ace wrap, whenever you put the ace wrap on, the ace wrap is simply holding the splint to the patient. You do not pull the ace wrap on. Okay? You do not, if you're short with the ace wrap, don't pull it to make it reach. Ace wraps are dangerous. You want to cause a compartment syndrome? Use an ace wrap. Wrong or incorrectly. It's getting there.
Doesn't that plaster dust like get wet in your lungs?
Yeah.
How does it get out of your body?
I don't know. I'll cough it up eventually when I get a cold or something. I don't know. People have been doing this for long time and never had any problems with the plaster. It's not like asbestos or anything like that. It's, from what I understand, it's not toxic to you.
Chips.
Yeah.
It's like chalk.
Yep. Yeah. Most of the time as well, whenever you're cutting off a cast, they have all the cast saws will have vacuums hooked to them to pull some of that dust, but it doesn't catch it all.
They also use it in drywalls
Yeah.
and in moldings and ceilings.
You use it everywhere.
Yeah.
Don't move. Your patient, again, can really hurt you by breaking your splint. It's starting to get hot. Do you feel a little heat? Yeah. That heat is called an exothermic reaction. It's a byproduct of it drying. Okay? It's normal. It has to heat up for it to dry. Can it burn a patient? It sure can.
Oh, yeah.
If you don't have a padding, if you got a little bald spot, or if you're using hot water, people tend to tell me that they use hot water because it speeds it up quicker, especially in surgery, and that is a disaster. So,
Oh, you don't leave this ace on us, no?
no, I'm taking it off because I'm going to show them. I'm taking the web roll off too, just to show them the splint and the true parameter of this splint that I'm going to bust them on. So, what did I say? 2 finger breadths below the antecubital space.
Yeah.
I am almost exactly 2 finger breadths below. I want him to be able to bend his fingers all the way down, make a fist. Pretty darn good. Distal or mid-palmar crease. What I'll also do is come up here and just simply make a nice fold of my web roll. Another option you've got. As long as you keep enough padding on the outside that you can do that. And you can do the same thing down here.
Why do you give the Jimmy Stewart itch? What do you do that?
Well, if you get an itch, you don't do anything about it. See, that reassures that I was able to do that. That reassures that the edges are padded. That's the number one reason why I ding you. See, you all start off with a 10. When you bring that thing to me, it's a 10. And when I see things that are wrong, I ding. That's 1 ding, that's 1 point. There's 2 dings, that's 2 points. 3 dings, that's 4 points. Okay? I just keep dinging you. So, I like to make sure everything is nice and padded. Then when you wrap your ace wrap on, it looks even better.
We put the ace paddles back where they get cohesion.
Yeah, because after I'm done, I like to take a look and make sure I have no wrinkles in my splint. Although, you really can't tell if it's wrinkled just by the outside. You have to know what's on the inside of this splint to see if it's truly wrinkled. And when I grade it, it's not unusual for me to take it apart and look and see if there's any wrinkles in there. And what you're looking for is it to be very, very smooth. The other thing that you will do is if it's broken, that's automatic 5. Take 5 points for it being broken. That's a broken splint. If it leaves the cast room or your cast room with this, it's going to come back with this much motion. If it has barely any motion, it's coming back in a couple of days like that. What's the purpose?
What caused this particular crack?
Okay. Plaster cures a lot like, or dries a lot like like concrete. It actually crystallizes. So basically, as it's drying, you break it, and once that crystal's been broken, it never can reform. That's a bad thing about plaster. Fiberglass, it breaks as well, but it's a lot harder to do it. But this right here, and I take your splints apart, and I go.
Can you see it? Can you see it when it's on there?
I can tell when it's on there too.
Can we tell?
You can tell. These are things you're going to learn as you go.
You just bent this?
I bent it. I did it. Don't try to take your splint off. If it's in a non-removable form like this, do not try to take it off and look at it and go, okay, it looks good, and put it back on and wrap it back up. Because you'll break it just trying